Only one thing, according to the FDA, the CDC, doctors, and scientists, that actually work at preventing COVID: the vaccine. That's it. Now, that hasn't stopped people from trying all sorts of treatments and unapproved drugs, most of them recommended on social media. The latest trend has people using very strong drugs meant for horses. Doctors say this could make you sick or even kill you. Kristen Severance explains in tonight's Verify.
We continue to get your questions about COVID and different treatments that people are seeing all over social media, like this one from Tracy. So she emailed us saying, I keep hearing that ivermectin is an effective treatment from COVID and is very safe. Can you shed some light? What have you heard? Okay, so right away, we want to tell you, according to the FDA, you should not use ivermectin to treat or prevent COVID-19. Our sources for this story: the Federal Drug Administration, Oregon Health and Science University, and KGW's medical expert, Dr. Pyle Coley. Ivermectin is often used in the U.S. to treat or prevent parasites in animals. The FDA has received multiple reports of people needing medical treatment, of people having to go to the hospital after self-medicating with ivermectin intended for horses. The FDA has not approved ivermectin for use in treating or preventing COVID-19 in humans. OHSU put out their own warning about this. The Oregon Poison Center at OHSU has received 9 calls this month about people intentionally misusing ivermectin. Compare that to only 3 cases of people misusing the drug in all of 2020. Ivermectin tablets are approved at very specific doses for some parasitic worms. Taking large doses of this drug is dangerous and can cause serious harm. If you have a prescription for ivermectin for an FDA-approved use, you should get it from a legitimate source and take it exactly as prescribed. Now, all of these things were also echoed by KGW's medical expert, Dr. Pyle Coley.
We've gotten several questions about this. Should people be taking this to treat COVID?
Absolutely not. 1.5 years into our fight against COVID, we have learned so much about it that we are not at the stage anymore when we need to be taking unsubstantiated therapies that offer no benefit and can offer potential risk for the treatment of COVID. We have a number of different therapies out there, including monoclonal antibodies, that have been reviewed by the FDA under emergency use authorization and are effective in changing the course of the illness. So taking unsubstantiated therapies because of social media hype is definitely not something we need to be doing right now.
So again, according to the FDA, you should not use ivermectin to treat or prevent COVID. The FDA said you should not use medications intended for animals, and that ivermectin preparations for animals are very different from those approved for humans. Look, we know there is a lot of information out there, a lot of misinformation out there, a lot of things circulating on social media. Do you have something you want us to verify? Let us know. All you have to do is email us at verify@kgw.com.